On today's episode, I talk about my thoughts on Nylabones and other dog chews. I go through the step-by-step process that you can take to clean your cat's teeth that also works in dogs. I'm going to talk about how to monitor a diabetic dog or cat at home. What can you do to make sure that their insulin treatment is working? Then I'm going to move on to how you can assess pain levels in a dog. And then the final question is all about the causes of twitching and seizures in a dog who's just given birth with a litter of 4 puppies. But first, here's the intro.
You're listening to the Dr. Alex Answers podcast, the show that answers all of your dog and cat health questions so they can live healthier, happier lives. And here's your host, veterinarian Dr. Alex Avery.
Welcome along to episode 12 of the Dr. Alex Answers Show. I'm Dr. Alex, the veterinarian behind ourpetshealth.com, where my aim is to help you and your pet live a healthier, happier life. I'm so grateful you're here, sharing your valuable time with me. And if we're meeting for the first time and you enjoy the show, make sure you subscribe to the podcast to help you look after your pet to the best of your ability. Now, you can also get your question answered and featured on an upcoming show just by heading over to dralexanswers.com. And before we get going, before we get into the questions, I'd just like to read you a review left by Azul from San Diego, who writes, "Finally, a show my dog loves. Love the fun and simple nature of this podcast, informative and on point. Dr. Alex is the real deal. Love the titles of the shows too." So thanks very much, Azul, for leaving me that kind review. Appreciate it so much. And if you do enjoy the show, I'd appreciate it if you could leave me a review as well. It helps more than you can imagine with other people finding this podcast, and that'll just help me to reach more pet owners and help more pets, which is what this is all about. And so jumping into my first question, which is from Bexy Boo, who writes that she was wondering what my thoughts on Nylabones and similar dog chews were. So her lab likes to gnaw on them every so often, and also on other things like antlers, yak milk bars, and other things like that. She'd love to hear my views on that. So this question was triggered by my discussion of the risks of bones in my raw diet review, and those risks really are that they can cause fractured teeth, which are a source of pain and a reason for tooth root abscesses from developing. So that's a bit of a mouthful. Bones also have a risk of causing obstruction, a potential obstruction, and also perforation of the intestines, resulting in septic peritonitis, which has a 50% mortality rate. So 50% of dogs that develop septic peritonitis are likely to die. So, there are some significant risks with bones. Now, antlers actually cause a similar problem, and they cause all those similar problems because they're also very, very hard. So they can break teeth, and if a small enough chunk is swallowed, then that can cause similar obstruction problems. Now, Nylabones, that's obviously a synthetic product, they are also incredibly hard and could cause fractures in teeth. Now, they're unlikely to get kind of shattered and splintered and so swallowed, but tooth fractures, like I say, they are painful. We definitely shouldn't ignore them. So unfortunately, all too often when a dog has a fractured teeth, they're still going to be eating. They're still going to appear like they're absolutely fine. They just don't let on that they are in pain. And if you've ever had any kind of dental problem, you'll know how painful they can be. But I always say that a dog or a cat, they don't know that if they stop eating, they're going to be taken to the vet and have their teeth fixed. They simply know that if they stop eating, they're going to die. So just imagine how painful it needs to be for them to stop eating. So we don't want them to use that as the end point. So really, any fractured teeth really need to be removed or addressed. Certainly we can do kind of crowns and things like that if advanced kind of dental care is something that you're interested in. But, that aside, really from a dental chew point of view, a kind of a rule of thumb that we suggest is that if it would hurt to be hit on the knee with something, then really it shouldn't be used as a chew toy for dogs. So what are my preferences then? Well, I prefer kind of the strong rubber chew toys like the ubiquitous Kongs. So I think they're fantastic. They need to be an appropriate size and they need to be an appropriate hardness for your dog. So, there's no point giving a really small breed dog Kong to a big, large Labrador because they potentially are going to swallow it or it's going to get stuck and they're going to choke. Also, if you've got a power chewer, then you want to use one of the harder, tougher black versions rather than the kind of the classic red version, which are a little bit softer. You're also going to need to discard them when they're getting worn, although generally they will last an incredibly long time. And you can also fill them with something tasty to encourage that chewing, to encourage them to kind of get absorbed in trying to get that tasty treat from the middle. So they're a great source of mental engagement, and can help to a certain degree with dental hygiene as well. But yeah, there are other food puzzles that we can use if we're talking about kind of mental engagement and trying to kind of make our pets' lives more interesting. And that includes kind of food puzzles, licky mats, snuffle pads, and various other things. And I'll leave some links to those in the show notes. So if you're interested in, getting your dog something like that, then check out the show notes. You always want to use kind of these particular toys under supervision. You don't want them kind of chewing bits off. Certainly the snuffle mats are kind of fabric strips that you hide food in, and the last thing you want is your dog to be chewing strips and swallowing those, because they can cause problems as well. Now, if we're then moving on to kind of dental specific chews, well, there are various options. What you really want to be doing is choosing one that has got a VOHC, or a Veterinary Oral Health Council seal of approval, because that means that there is some evidence that they do reduce or prevent tartar buildup. Now, they're not the be all and end all. They're not going to completely eliminate any tartar. They're not going to completely eliminate the need for doing other dental healthcare procedures. So that could be toothbrushing, and I'll move on to that in another question. Or dental diets, and also kind of intermittent health, kind of cleaning, kind of hygiene cleaning with a scaler and polishing, just to try and keep things nice and clean. Oral health is really important for general body health, so it's definitely something to think about. So like I say, there are a number of other things we should do, but if we're looking at dental specific chews, you want to be looking for that VOHC seal of approval, and that can also go with other oral care products, toothpaste, and that kind of thing. So really, those are my thoughts. We want to avoid the really hard chew, so Nylabones, antlers, and that kind of thing, as well as bones, and consider some of these other options instead. And so that brings me on nicely to the fact that this episode is brought to you by the Our Pets Health Pain Monitoring Chart for dogs and cats. So be certain that your pet is comfortable and that any pain management plan is actually working. So just head over to dralexanswers.com today and sign up for free access to the Knowledge Vault, which gives you access to these charts and a whole load of other helpful free downloads.
You're listening to the Dr. Alex Answers Show.
And the next question is from Gloria, who asks, how can I get a pain score from a dog? So this was in response to a piece on monitoring the effects of treatment on the comfort levels of an arthritic dog, but it could apply to any painful condition. So really, the reason for this is that arthritis is a dynamic disease, and a treatment plan can involve many different facets. So, painkillers are one kind of part of a treatment plan, but also we've got supplementation, dietary supplements, we've got weight management, exercise, physiotherapy, kind of home aids, environmental management. There's an awful lot to a pain treatment plan. Arthritis is also a progressive disease, so it will get worse with time, as well as maybe have flare-ups where a dog, maybe has a mild knock and becomes much more uncomfortable before settling down to kind of their previous level. So we really need to keep an eye on comfort levels of your dog, and this also goes to cats, just so that you know that the treatment you're giving is actually helping to begin with. Especially if you're only giving supplements and doing other management strategies, there is a possibility that although you might feel that there is a benefit, when we look at giving kind of a pain score, you find that actually your dog still is painful and we need to do other things. And so we want to know that the treatment's working to begin with, and it's continuing to work to the degree that it always has done, as time goes by and as the disease progresses. So giving having a pain score, it allows you to really add interventions and modify the treatment plan if your dog seems to be becoming more painful. Now, there aren't many good easy to use monitoring systems out there that I'm aware of that have been validated to show that they correlate really well with pain levels in dogs when used by dog owners at home. Now, that said, I have produced a simple pain monitoring chart myself that just asks you a few questions that you kind of circle a score, and then that gives you an overall score that gives you an indicator of whether your dog might be in pain at all. Now, it might not correlate well with all dogs, but it really should give you a rough idea of their comfort levels. And if they have a really high score, or if they kind of have a consistently low score and then that starts to rise after being stable for a period of time, then that really should prompt reevaluation of their treatment plan. It's really important that we treat these guys effectively. There's no point in just saying, well, I'm doing X, Y, or Z and leave it at that, because your dog might still be in pain. There's no one treatment that will guarantee them living a pain-free life, being comfortable and having the best quality of life possible. So we should always be monitoring, and monitoring is one of the most important parts of an arthritis treatment plan or a treatment for any painful condition, just to make sure your pet is living their best life possible. And my next question is from Pug B, who writes that they have a Labrador that's 5 years old, gave birth to 4 healthy puppies 9 days ago, but today saw her starting to become wobbly, kind of lying and shaking, and it looked like a convulsion or a short seizure. They talked to their vet, who said to report and count the frequency of the seizures for 3 weeks, but do I have any advice to help with that, or any ideas what could be the cause? Well, I'll start off by saying kind of causes of seizures in general. We've got poisoning, we've got organ disease or blood abnormalities, we've got infections, and we've got brain lesions, and we've got epilepsy. Now, kind of being in either late pregnancy or during early lactation, my concerns would be that a dog has a really high calcium drain. So you've got the puppies, skeletons are maturing kind of in late pregnancy, and then the milk production is coming in. Now, depending on kind of whether your dog is an older dog and had puppies before, sometimes that milk can come in kind of quite early, a long time before they're going to give birth, but then also once they've given birth, they've obviously got all these hungry mouths to feed, so they're producing an awful lot of milk, and all this can lead to low blood calcium levels, which can cause something called eclampsia or milk fever, or puerperal tetany is kind of all other names for the same condition. These low calcium levels can cause a range of symptoms, and that can include muscle tremors, it can include stiffness, and it can also include full-blown seizures, which ultimately, if left untreated, is going to be fatal. So, it's potentially a really serious thing. Other symptoms of low calcium levels can include restlessness, maybe disorientation, your dog might be panting, and they can even develop facial itching, so they'll kind of be rubbing their face or kind of scratching their face. So, yeah. That would be my concern with this dog, that it's actually got low calcium levels. That is something that we really need to think about getting on top of, straight away. So that shouldn't be, we shouldn't be leaving this for any length of time. Now, there are other reasons that this condition can develop in pregnant dogs or in dogs that have had litters, and that could be if they have been receiving calcium supplementation during pregnancy, because this affects how well the body is able to mobilize the calcium once the milk production starts. It could also be due to feeding an inappropriate diet, being in a poor body condition, the mother being in a poor body condition, or having a big litter or big pup, so again, lots of hungry mouths to feed, and also first litter dogs and small breed toy dogs are more at risk from developing this condition, although it can affect any breed of dog, and regardless of how many litters they've had before. It's most commonly seen in the first 40 days after giving birth. It's rarely before birth, but it absolutely can be. And treatment needs to be intravenous calcium to really raise that calcium, blood calcium levels back up to normal as quickly as we can, because like I say, this can be fatal. We can get seizures and we can get fatalities. We also then need to take the pups off the mother and bottle feed them, certainly for 24 hours, preferably for longer, and preferably if possible for good, so that the mother no longer has that big calcium drain. Now, if you're going to put the puppies back on the mother once she's stabilized, there is going to be a risk of repeat low calcium levels forming. So repeat milk fever from developing, or a repeat eclampsia. And so calcium supplementation is going to be a good idea, and just keeping a regular check of those calcium levels kind of while you're while the female dog is nursing the puppies. And the bottom line is that a female dog who is about to or has given birth within the last 40 days or so, that starts twitching, becomes stiff, or has a seizure, really, in my opinion, that should be seen by the vet as a matter of an emergency and their blood calcium levels checked.
Get your question answered at dralexanswers.com.
And so moving on to the next question, which is from TB, who asks, can you talk about calibrating a human glucose meter for a dog? So I'll start off by saying, well, home monitoring of blood glucose is an excellent way to monitor insulin treatment in a diabetic dog or a diabetic cat. It's very simple to do in the vast majority of cases, not in every case, but in the vast majority, it's something that's very easy to do, and you don't get a stress effect which can cause a really high, an artificially high blood glucose level compared to having serial blood glucose levels taken at the vet. Like I say, it's generally easy, very well tolerated. We tend to take blood from the ear margin. That's generally the easiest way. So what you do is you just take a small needle and you do a little prick on the edge of the ear. That gets you a tiny little bit of blood, which is all you need to get a blood glucose level. Now, if you're struggling to get that, then you can use a warm towel held over the ear, which just causes the blood vessels to dilate and makes it more likely that you'll get some blood. And if you're finding that the blood is kind of just smearing and kind of running over into the fur, and you're not really able to get enough to go into the machine, then you can actually put a very thin smear of petroleum jelly or Vaseline over the area that you'll prick, and that will cause a nice blood blob to form. A little bit of pressure, stop the bleeding. It's a really tiny amount and it's very simple, and your pet's hardly going to notice. Now, moving on to kind of human glucometers. So they aren't as accurate as pet specific ones, and that's because glucose is present in different proportions in the serum and in the red blood cells in different species, and also different species have different PCVs, so amounts of red blood cells circulating in the blood. There is quite a big difference between humans and dogs and cats. There is a small difference between dogs and cats as well, but not so much. Now, that means that ideally we're going to want to use a pet-specific glucometer. They are reasonably cheap to buy, but test strips are much more expensive than human strips. Now, that said, when we're monitoring glucose levels, blood glucose levels in our dogs and cats, we're not using those to micromanage or to change the insulin dose on a daily basis. So it's very different from kind of human diabetes management. So from that point of view, you're not going to use as many strips as a human diabetic would tend to use. So that cost difference maybe isn't so much. It's definitely something to think about, and it's going to be a long-term cost. Something to think about. It may actually work out perfectly fine for you to get a pet glucometer and use the strips that are needed for that without breaking the bank. But, that said, it is okay to use a human glucometer. The way to get that calibrated so that you know exactly what the blood glucose level in your pet is to actually have your vet run a blood glucose curve on your pet using their glucometer as well as yours at the same time. And that way you can compare the two readings and get an idea of the level of blood glucose that the reading on your machine would correlate to. So that's definitely something to think about doing if you're using a human glucometer. And they are fine to use. Certainly in previous practices, that's actually what we've used when we've been taking spot blood glucose measures, and then we've gone on to different equipment if we've kind of needed to for any particular reason. Also, that being said, there are other ways that we can monitor diabetes at home. Like I say, we're not wanting to micromanage insulin dose based on the blood glucose levels. And so there are other things that we can do and look out for that will give an indicator that in general, a dog or a cat is controlled to a good degree and is nice and stable with their diabetic management. So that includes keeping an eye on their weight. So are they losing weight, which would indicate that actually things aren't being controlled nicely? What's their appetite like? Are they really hungry? Again, if the diabetes is not well controlled and the blood glucose is very high, then effectively they're urinating out an awful lot of glucose and energy, and so they remain very hungry. Also, the body is effectively, the cells are kind of starved for glucose even though there's loads in the blood. So that's another thing. Amount being drunk is also a kind of a real key indicator. If all of a sudden your dog or your cat starts to drink a lot more again, then that's going to indicate that the blood glucose levels are higher and the diabetes is not as well controlled. And then also just their general demeanor. Are they happy or are they sick? A happy dog, a happy pet is unlikely to be in kind of serious dire straits with diabetic management. And if their drinking is kind of low, if they're maintaining a stable weight, then the likelihood is that their insulin dose that they're on is absolutely sufficient. Finally, we can also use urine strips to look at the glucose and also ketone levels in the urine. So if we're seeing glucose in the urine, then that means that the levels are higher than they should normally be. And if we're seeing something called ketones, then actually we know that we're about to, that the dog or a cat is really not very well controlled at all and is going to become sick very soon. So we definitely need to jump on that. So that's a very simple thing to do. You just collect a wee little urine sample, dip the strip in, and look for a color change, which is something, that you can discuss with your vet as well. So you can definitely use a human glucometer, but there are other things as well. If, for example, your pet doesn't tolerate having their blood glucose measured, or it's not something that you're able to do for whatever reason, there are other ways that you can monitor a diabetic patient at home. And just remember that the information that I give in these podcasts is not a substitute for a consultation and examination with your pet's veterinarian and should not be taken as specific advice for any individual pet. If your pet is unwell, if they're injured, or if they're suffering from any kind of problem, then talking to your vet is always the best course of action. And then my final question is from Casa Nova, who writes, can you please make a detailed discussion on taking care of cats' teeth? Kind of when should you start brushing? How do you brush them? How do you go about starting to brush your cat's teeth? How often should you be brushing them? And how long should you brush your cat's teeth for? So I guess I'll start off by saying that I will put up a video on YouTube and in the show notes at ourpetshealth.com with kind of showing you how I go about doing this and how to hold your cat. So, it can be quite visual. So, you can help see how to hold your cat and how to go about it. So that might help. But, I'll just run through the steps today that will help you to start brushing your cat's teeth. So the first step is to choose a pet-specific toothpaste. Choose a flavour that your cat likes. They come in many different flavours, so poultry, malt, or fish. Just something that your cat will find tasty and will actually enjoy having. We never want to use a human toothpaste, so that can cause problems with the guts and also can cause fluoride toxicity as well, because they're going to swallow that toothpaste rather than spit it out like you or I would. And to start off with, you want to use the toothpaste as a treat and have your cat lick it off your finger, while you're giving them attention, while you're petting them. So they just associate the toothpaste with a good experience and, something that they enjoy. Now, next, we also want to get them used to having their mouth handled and their lip lifted. We don't want to be doing any more than that. Just get used to, having their head held, their mouth handled, open up their mouth, lifting their lip, just to get used to that without actually trying to do anything to the teeth, without touching the teeth, without trying to brush them. Once they're happy with that and they're enjoying the toothpaste, you want to start off with having some toothpaste on your finger and then using that just to wipe the teeth gently. Again, that's just really getting them used to having their mouth handled and having something kind of rubbed around their teeth. Next, once they're used to that, we want to start maybe by wrapping a little bit of gauze around our finger. That gives a little bit of an abrasive texture, a bit of an abrasive surface, and maybe start to kind of take a more brushing action. So yeah, just backwards and forwards, maybe small circles. We want to make sure that we're getting the back teeth as well. So the front teeth are easier to see, but we want to be getting our finger right to the back of the mouth to get those outside surfaces on the big back molars, because that's actually a really big source of tartar buildup and gingivitis and disease, kind of dental disease. So we want to make sure we're brushing all of those. And then once your cat's happy with that, we can move on to either using a finger brush, so that's often a little silicone brush that fits on the end of your finger, or using a small pet toothbrush. Now we want to be using, again, a pet toothbrush because they have softer bristles than a human toothbrush, so you're not going to do any damage and it's going to be accepted much better. And they can also have an angled head, which again makes it much easier to brush your cat's teeth and to get to those back teeth, like I said before. This is all a slow process. We want to keep it calm. We want to keep it fun. And we want your pet to accept it at every stage. We don't want to get into a situation where you're trying to hold your cat down. You're kind of having to wrap them in a towel to get that done so that you're not getting scratched, because really it's not going to happen as regularly as it needs to. You're not going to do a very good job and it's going to be counterproductive. So at each step, you want to make sure that your cat is accepting that readily and you're not having any problems. When you're starting off, you also want to be rewarding them after each time, just again, so they're associating this experience with having a reward, and that could be giving them a separate tasty treat each time you do one of these exercises. Then as you go on and as you start brushing your cat's teeth regularly, you can give them a reward every now and then just to keep their interest. Now, as for how often you should brush your cat's teeth or your dog's teeth, really we want to be doing it at least 3 times a week. That's really the absolute minimum. If we're doing it less than that, then we're unlikely to be getting a huge amount of benefit from having it done, and also your cat's not going to be getting used to having it done. Preferably we want to be doing it daily, and really for how long we want to be brushing each time, really as long as your cat will allow, without getting fed up, without getting angry, without having you having to do battle. Now, 1 minute every day would be fantastic, but if it's kind of 15 seconds, 20 seconds every day, then that's definitely going to be better than nothing. And as for when to start, if you start when your cat is a kitten, they're going to be much more accepting of having this done. So they've obviously got their kitten teeth, so we're not really so worried about cleaning their kitten teeth. It's more just the act of handling. They're going to be used to that handling handling. They're going to be used to having their lip lifted and having their teeth brushed. So when they get their adult teeth, when they get older, they're going to be really accepting of this. And I guess the last thing to say is that when we're brushing, we really do just want to focus on the outsides of the teeth. You don't have to worry about getting your cat to open their mouth and kind of brush on the inside surfaces. It's not going to happen. We don't typically see disease nearly as bad on the inside surfaces of the teeth compared to the outside. So hopefully that helps. Toothbrushing is really important. It's the best way that we have to stave off dental disease, and dental disease can have a massive impact on general body health. So I definitely encourage you to do that if you think it's something that you could fit into your daily routine. And that's it for this episode of the podcast. Make sure you subscribe if you enjoy these episodes. And if you could spare a couple of minutes, I'd appreciate it so much if you could head over to iTunes to leave me a review. Or if you're not listening through iTunes, head over to ourpetshealth.com/review. And that's just going to help more people discover this podcast and allow me to help more pets. Remember too to head over to dralexanswers.com, where you'll find all of the links and downloads mentioned in today's show. And until next time, take care.
You've been listening to the Dr. Alex Answers podcast. Be sure to rate, review, subscribe, and we'll see you on the next episode of the show where you ask the questions and Dr. Alex answers.